how many of you ever had a tailbone injury? Okay, let's have you come up. This is a different injury. When you fall on the tailbone, the force travels up the spine and it gets stuck in the back of the neck right here. Okay?
In fact, when I landed, I was holding my neck and they thought that I hit my head.
Wow.
It was on a concrete floor. A guy pulled a chair out.
Okay, so let me just wear these so I can see what I'm going to do. Now, is your tailbone hurt? Does your back hurt?
My neck.
Your neck hurts.
More
Okay.
right now, today. Normally, everything hurts, but.
Okay. This normally will get rid of back pain from a fall on the tailbone. So what we're going to do is we're going to release the stress that's stuck up here between the skull and the first bone. The skull bone is called the occiput. It's a new word, occiput, back of the skull. So you got all these muscles back here. So what I'm going to do is I'm going to take my thumb and just stretch the occiput to the first bone. And again, we'll do this in the next section, but I'm just going to do it to show you something. So see how I kind of just stretch? I'm like lifting your head up. This one's hard to do on yourself. Now, the most important part of this is making sure that you don't mess up her hair.
I was going to say that.
So I'm really cautious about that. Yeah, this thing, knots. Like there's no motion. It's like stuck there. So I have to really stretch. I'm taking the head like a bowling ball, and I'm bringing it up this way. The right side is fine. The left side is frozen. So I have to kind of, these ligaments here are like saran wrap. So we have to stretch it.
Right. I was going to say, could you really feel the knots?
Yeah. Yeah, you can really feel these knots.
This injury was in 1986.
Ooh, that's a lot.
So the longer it takes, the
more
it might take
a
a couple visits to do this.
Are you pressing very much with the hand that's on her neck, the back of her neck? Are you pressing in?
I'm like right underneath the skull, and I'm trying to stretch that thing.
So you're manipulating it?
I'm stretching it. Okay, so now, did that give you any relief?
Yes.
Okay, now, in your skull, you have joints. It's called sutures. They're on the top. Guess where the force also is stuck? On the suture on the top of the skull. So I'm going to take my thumb and go forward. Remember, it's going to hurt on the opposite side of the butt bone. So the top of the head. And I'm going to go forward, and I'm just taking my thumb and inching slowly forward without messing up her hair. This should be a little tender, too. Is that tender?
Mm-hmm.
Is it a good tender, or is it a bad tender?
A good time.
Okay. Yeah, I can feel there's like a ridge, like a volcano right here.
Is that why I blow up every now and then?
No. Oh, right here. Yeah,
Like a volcano.
I'm getting hot just working on this because the heat's just coming right off.
Are you calling me a hothead?
No.
Oh, it's just all kinds of conveniences. Oh, yes.
I go all the way to the front, and I'm pressing down on the suture. Okay, so how does that feel?
Oh my. My head feels lighter.
Awesome.
Wow.
Thanks for coming up, Debbie.
Oh, thank you.
You're welcome. Hey guys, thank you so much for watching. Please click the subscribe button, and I will see you in the next video.